introduce the first panel, Mr. Federico Peter Quadre. Yeah, he's a policy expert and he has a technical uh, experience and support for the CRPD implementation and SDG. And his background and the particularly in rural development and government, and he professionally uh, experience work in the global south and in the United Nations. So the floor is yours. Please welcome Mr. Correa.
Good morning, everyone. It's great to be with you guys here today. And also, I wanted to mention that I'm just going to put my timer on because if not, I'm going to talk way too long. But I wanted to mention that although I think we'll have questions after, if there's something burning, just feel free to stop me. So I'm Latino, so I'm used to very much this interactive, fiery dialogue, so please feel free to stop. And just to let you know, so I'm a very tall person with long curly black hair, and I have a big smile. And usually people say my voice is quite funny. So anyway, that's a little bit about me. I'm coming here from Barcelona, and I really wanted to go. It was really interesting when Dr. Anya had written me. I was surprised because with the topic of climate, but a lot of the work that I've been doing in the last few years with local governments is really shifting the look from climate to a more personal perspective with people and promoting the rights from that aspect is what's kind of what I'm going to highlight, and also bringing in the aspect of what we've been doing with local and regional authorities. And I think this will also shift a little bit towards talking about how we look after the crisis, because particularly with COVID-19, I think a lot of not only national governments, but also civil society have been seeing that dialogue with local governments and regional governments can be really key to more disability inclusive action, both in the aspect of conflict, crisis, and in climate. So this goes into a little bit the frameworks that we're looking at, which are really important today. Of course, the CRPD as the key legal framework, but also a few others that have been really championing a look at disability more as diversity. And I want to come from this accessibility and universal design lens, that a lot of disability inclusive development at the end is very much beneficial for the broader members of society. And that's really important, especially in the aspect of coming up with responses with governments. Because as much as we know that social inclusion, human rights is really key and important to resilience, there is that importance of coming with data and facts and showing these co-benefits, because there's the really big thing that always happens in terms of programming, especially in governments, which is financing. And so the more that you can show those co-benefits, it's going to be much clearer to the governments and much more of the innovation that really a lot of us can see from accessibility and from looking at disability as diversity, and really speaking to that paradigm shift that the convention tries to promote through the different articles. So leading into going from that, the most important thing I think to kind of give you the frame is we have the CRPD as a legal framework, but and everybody knows the Sustainable Development Goals, which also require a look at the CRPD to really be implemented. But two other ones that are not so commonly known, and maybe you do know them, but we have also the New Urban Agenda, which was adopted in 2016 in Quito. And the New Urban Agenda really looks at how our world is rapidly urbanizing, with 70% of the population estimated to live in cities by 2050. And actually, if we look at persons with disabilities, and also in a lot of the work that I do, we look at older persons, they actually make up a large part of the people in cities. So out of the data of the amount of persons with disabilities and older persons, over half right now are living in cities and towns. And that's estimated to double also, so by 2050. So there's a really key aspect, not only of looking at involving local governments in the CRPD, but also there's the data there that a lot of the trend that we're seeing, even after COVID, is still in cities and towns. And this is not to forget the rural side, but also that a lot of the connections that we have, we call it the rural-urban continuum, requires a lot of coordination with local governments, along with their national governments. So that New Urban Agenda document actually makes 25 specific mentions to persons with disabilities and older persons as key to the implementation of the agenda. And in the World Urban Forum, which is the mechanism for review of this New Urban Agenda, accessibility was set as a key pillar to the New Urban Agenda's implementation. So that's one of the frameworks that also, in addition to the CRPD and the SDGs, that will be really important to actually realizing a more equitable world. And then we've been working a lot with the WHO's Age-Friendly Cities framework. And as you know, that although not all older persons are in the intersectional lens of persons with disabilities, but there are many, and a lot of the shift also from going from working into retirement presents a lot of barriers of their own, both in not only in terms of mobility, but also in terms of economic empowerment and independent living, and also dignity. So a lot of the things that the CRPD also looks to promote is also very key to what a lot of the community of older persons is trying to fight for. And unfortunately, older persons don't have their own convention. And as you know, the Convention for Disability Rights was a really key mover, and as being one of the most rapidly adopted, and a lot of shifting protections to really push governments towards that more implementation lens. And not only looking at disability as charity, but disability very much is a key part of their strategies. So those are the 4 frameworks that we're really looking at. And really interestingly, and this happened a little bit early on, and I think from seeing, being able to work with different stakeholders, as well as private sector, and seeing that the way local governments can rapidly adapt or rapidly implement some things that usually at the national level take many, many years to coordinate or even get past this just legal adoption. Because although we have the legal framework, which is really great, I think what we all would like to see is that trickle down and actually mean something to the people who are there, and for people not to have to wait 10 to 15 years to reach a resolution. And that's really key where local and regional governments have come in. But one of the challenges a bit is not having adequate resources, which a lot of the resources come from the central government, and they decide where that's going, right? And so early on, we started in a lot of the advocacy we're doing at the UN. We started to interact, early on also with the city of New York, because where the Conference of State Parties happens is in New York City. And I don't know if you know, but a lot of local municipalities have offices that are dedicated to disability inclusion. Also, some, they have a bigger capacity, they also have a separate office that's dedicated to accessibility, because accessibility can touch different communities. For example, we always go into when you look at the curb cuts or the ramps, when they were first constructed, right, the idea was thinking, oh, but should we actually put these ramps in just for, and I use just in quotation marks, just for wheelchair users or people with reduced mobility? And, there was a big thing about, it's a big investment, is it going to be helpful? We don't really see anybody with with disabilities on the street, which is always a very funny thing because less about the question of why there aren't the people there and more that there aren't. But afterwards, the really interesting thing when you look at the curb cuts, whether you're using a wheelchair, whether you're using a cane, whether you're having a huge luggage, whether you're taking your kid around in a little baby wagon, there's many co-benefits to that ramp, And also in some environments, a lot of cyclists also use the ramp to avoid, oncoming traffic. So there's a lot of benefits to the ramp, and I think that was kind of shift a little bit, and I say a little bit because I think it's still hard to translate it into other areas that also have co-benefits. But that was a shift to start to see that actually investing in this can be part of innovation, and I think that also when you look at who actually needs to translate all of those into programs and into actual things, it's local governments, right? So they're taking this legal framework, putting some regulations, and figuring out, how do we actually look at this in the context that we're in, whether it's a city, like one of the cities I work with, which is Banjarmasin in Indonesia, which is known as the city of 1,000 rivers, or a city like Sao Paulo, which has a really intense grid plan that grew out of really unplanned. So the mobility strategies are really different, but they're there. They're kind of those key mobilities, and this has been like the kind of interesting lens also about looking at the CRPD at the local level, because it's the principles are really important, but the way that it gets implemented is very unique. So anyway, going back to what I was saying, we started to connect with New York City, and New York City has a lot of challenges in terms of not only disability inclusion, but other areas. But when we met them, they said, well, we want to be the most accessible city in the world. And that was really interesting, thinking that, unfortunately, local governments are not really involved in this type of dialogue, but a lot of them actually have these ambitions, but are missing a lot of the capacity to implement a lot of those things. And this is where I think, voices like the speakers here and also voices like yours really are important, because there is this, professionalism and technical expertise that's really needed within local governments to take forward this work. Because there is a lot of political will there, but it's about knowing, what does the CRPD mean to me when I'm looking at buildings? Which are the standards that I should be really implementing? Now we're looking at a lot of the digital space, right? So what is digital accessibility? How can I ensure that my investments in information and communications technology are also relevant to Article 9, which is one of the first human rights conventions to recognize access to technology, especially digital technologies, as a human right. And those things are where we start to hone in and really look at how we localize this kind of global frameworks. From there, really interestingly enough, and with civil society coordination, and there's also a lot of networks of local and regional governments, there was a really interesting idea to kind of unite the different key principles from those 4 frameworks that I mentioned earlier, and really look at them as a key tool for local governments into implementing more disability inclusive policies and programs. It's been a long movement, but there's a growing number of cities right now, 50, that are knowing, not that they're doing, because there's many more, but that they actually know the legal framework, they're knowing the standards, knowing how to translate them into different programs, and also sharing what they're doing at the international level, and bridging that gap in dialogue with member states. And another aspect that's really interesting when you look at local governments is they can also, in areas, because in some contexts, civil society, especially organizations of persons with disabilities and older persons, don't have so much access to the national government. But local governments are really open, and also they're right there sometimes. They're right there in the city hall. They're they're right there in your communities, and they're most interested in your local vote because it means something there in your community. So they can be also that bridge in connecting with national governments, especially on really specific areas. So we're also trying to bring in that aspect of civil society coordination and organizations of persons with disabilities as key partners to local governments in the implementation of these rights. And another aspect that we started to see as well is in terms of employment for persons with disabilities, local and regional governments are also opening up a lot of those lenses. There's a lot of the heads of departments of disability are persons with disabilities within the local government. And also when even better, which we talk about a lot, is like the idea that one day there won't be a disability department. There'll be more like a person with a disability in each of the departments, or a person that knows about accessibility in each of the departments. But some cities are also doing that as well, having really decision makers. There's a city like Villa Carlos Paz that one of the councilors, she's a woman with a disability, she has direct access to the mayor, so she has a way to really intervene and ensure that decisions take a disability inclusive lens, and also having this look at the CRPD. And I wanted to give all of that kind of frame just to say that when we started to see the COVID-19 pandemic, there's a lot of other crises, but this is the one that I think is more, we can relate to the most because it's just the most recent. The first responders were local governments. And depending on the knowledge that they had and about local data in their community, about who's represented, about who's having the gaps from employment to housing, really was important to how their response was. And that was a really key thing to having this lens of the CRPD and having these kind of voices of cities that really knew that, okay, 13%, for example, Mersin has, that's in Turkey, a city in Turkey, has really clear data that 13% of their population are persons with disabilities. And also data on other communities that benefit from accessibility or disability inclusive lens. So for them, when their strategy was being, on the crisis was being put together, they knew they needed a sign language interpreter. They knew they needed mental health services. There was really something that was very important, and also the link that it was for them as a city that wants to promote more human rights was very clear. And so there's this lens that as we pivot from this crisis and a lot of the things that we learned, I think both national governments and civil society can say this, but also the relevancy of working with local governments, not only during crisis, but also before that, to ensure that it's more about resilience and that we're building resilience in the long term leading up, so that we don't get to a crisis and not know, where people are, what to do, what are the key issues that really need to come together. But there's still a lot of challenges into really honing in a lot of what this multi-stakeholder engagement can be. There's still a lot of mechanisms that we need to actually instill. There's still a lot more expertise that's needed, that's missing in this space. But it's opening up, and I think it's one of those things that gets more and more highlighted. And what's been exciting in this lens is just seeing, from dialogue and moving into action, and also that I think that as we move forward and we pivot and we, like they were saying here, pivoting after the crisis, there's just a strong need for us to embed accessibility as really a core principle of resilience or core principle of development, and that this aspects of Nothing About Us Without Us is not only disability, but it's about our continuum as a human species, and also the way that we look at human diversity and building areas, or in my work we like to say cities for a lifetime. So basically, when you're a kid until the day that you die, if you want to, you can stay in the exact place that you want to stay and do exactly what you want to do and really feel dignified and a part of your environment. So this is what I wanted to share with you guys, and hopefully that helps a little bit thinking in a lot of the things that you'll grow into do, and ways that you can apply your skills also legally into very tangible activities that have lasting change. Thank you.
Thank you. Thank you very much, Quadre. So we have learned a lot from you about the many important things to like local government and the participation of persons with disability in the implementation, and also using the framework such as CRPD, SDG, and urban development, something like that. So that will not to deviate to the concept and understanding of disability. So this is very rich knowledge we have learned from you, and thank you very much. So another panelist is we're going to present is she is visually impaired activist, Miss Benaf Yashubi, Yakubi. Is that right? Yeah, please correct me. Yeah, a little bit confusing. So she's a human rights activist, and she is a founder of organization for the blind service center, as well as she has an experience on working for the Attorney General in Afghanistan, and she is two master degrees holders on political science and international relationship. Currently, she's taking PhD on political science. So she will present us on regarding to the conflicts and we have learned from her presentation. Welcome, please, Panisha Yakubi. Yes, please correct my name. Oh, right hand side. Okay, sorry. Yeah, both of us are visually impaired, both. So I thought.
It's a good coordination.
Yes, thank you.
We can move you back here now. Okay.
Hello, everybody. Good morning. Good morning, good afternoon, good evening, wherever you are. Such a big privilege and honor for me that I'm speaking here and I'm standing here and you're hearing me. Thank you all. I was so excited for today and for today's speech, but I think I'll have a very big and heavy burden upon my shoulders when I want to speak about Afghanistan, about a country full of crisis and conflict with you, specifically after yesterday's bad news that we have from my country because of the very, very strong earthquake, and more than 1,000 people were killed, and still we have lots of people we don't know about them. So sorry if my voice is a bit down or please. So you know, all decades of war and conflicts make most of Afghan people acquainted with lots of maybe disability, death, and injured. and we are acquainted with all of these things. 13.7% of all population of Afghan nation are suffering from the severe, at least one severe disability through the one survey that Asia Foundation did in 2019. So I started my research about these things, and I used to from two methods. One was like a desk review, and the other was some interviews with some person inside that country, and some interviews and questionnaire from some experts out of the Afghanistan country, person who are stakeholder for people with disabilities and like this. Our focus would be in two periods, one from 2001 to 2021, when we have, as an aftermath of Bonn Conference, the Republic area of Afghanistan, that was a relatively democratic government. And then we will speak a little bit about the, after August 15, 2021, the second takeover of Taliban from the time that they came to the power. So in that time, in 2001, after we had our government Republic area, the Republic area tried to fulfill lots of accepted things, like universally things in case of persons with disability. We had our in our constitution, specifically in Article 53, we guaranteed the rights of persons with disability. And after this, we had our law for the rights and privilege of persons with disability. And we had some departments for persons with disability, as maybe ministry, deputy ministry, kind of ministry, state ministry, and then so we tried a lot to have something for people with disability to monitor from the government side to their rights and implement the law. And after this, the Afghan government ratified the Convention of the Rights of Persons with Disability and the optional protocol. And after this, we connected to Marrakesh Treaty. So we tried to look forward and to see and to go forward. Although there was lots of problems and challenges in case of accessibility, in case of education rights. So most of people with disability, they didn't have access to their education rights, to their health rights, and to, because there was no accessible transportation. So lots of us had problems to go and come and walk in the streets. There was lots of issues and problems. And then we had some, in some ministry of governmental ministry, we had like a unique department for persons with disability, like economic ministry, like judge ministry, like education ministry. We had like these unique, and then these units, and then we had independent commissions who work for persons with disability in somehow, like Afghanistan Human Rights Commission, Independent Human Rights Commission, who established in 2002 as results of Conference Bonn and based off Afghanistan Constitution and Paris Principle. And in that commission, we had a unit for persons with disability who try to protect and promote rights of persons with disability. And the other Independent Human Rights Commission, in the name of civic services, then in this commission, they try to think about the labor rights for persons with disability. Because in our law for the rights and privilege of persons with disability, was kind of national law, we had that 3% of all employees in all governmental ministries should be persons with disability. But because we didn't have good mechanism to include people with disability there, so we were not so successful in that. And in case of our law, because we had an article. It was kind of discrimination about non-war affected persons with disability. There was they couldn't benefit from the financial aid from the government because they were not war affected disabled. So through the UNCRPD, it was failed. It was it was not so successful. But in civic society and in the person with disability stakeholder who are non-government and the Afghanistan Human Rights Commission, we tried a lot to change this law, and we were the last steps of changing this article before the collapse. So it is not easy then when we try to speak about bad things, but at least it was some achievement. So I'm going to Afghanistan Independent Human Rights Commission, that I had a chance to work with this commission for at least 2 years from 2019 till 2021. This commission tried to monitor the implementation of UNCRPD and the implementation of the national law for the rights and privileges of persons with disability. Some of the achievement was for persons with disability was publishing some bulletin in Braille. It was monthly in the name of Human Rights Bulletin something, because we wanted to tell all people with disability. We published this bulletin in the Braille format and audio and the other format for all people. We tried to tell all people with disability in all of Afghanistan what's their rights, because this was a big challenge for Afghan people. Most of them, they don't know what's their real rights and what can they ask and what can they not ask. Another achievement was we had a kind of joint effort with the Administrative Civic Services Commission, because we wanted to have a good mechanism, and we tried to have a joint effort to implement that article for their labor rights, because as I told you, it was not implemented completely. So we tried to have like that, and after this we tried to send lots of people with disability to the job through this joint effort. Maybe it's interesting for you, till 2019 it was impossible for persons with sensory disability to have their own bank account in Afghanistan. So I want to tell you my story a bit as a fan. So when I went to Attorney General office and I got as an attorney, I start my work there. They told me you must have a kind of governmental bank account. So I went there and they said you can't have. You must have one person with you, as you are like a, how can I say, lawyer or somehow, who should be with you and who should help you when you want to have some money from us, deposit or withdraw or something. So I fought a lot, maybe for 1 or 2 hours. And this fight was not just for me, it was for lots of persons with disability. At the end, they said, okay, we will open this bank account for you, just we want to make a video. They said they want to make a video, and then this video should be an evidence for them that I want to make this account for myself with my responsibility. And I said, okay, it's okay, we can do that. So after this, we tried a lot, but it was not possible because, you know, as an attorney, I didn't have this authority to make it for lots of people. But I sent most people with disability, and I told them you can go and advocate for yourself, and at the end they will do. So after I went to Afghanistan Human Rights Commission, we had some meetings with the Afghanistan Central Bank, and then we, after there lots of debate and discussion, at the end they said, okay, we have these things, we have these things, and then they had lots of accessibility for persons with disability, even for persons with sensory disability. And at the end, in 2019, we found this creation to all people with sensory disability in all over the Afghanistan could have their own bank account without any problem and issue. And then the other problem for person with disability in our country was that most of people, they didn't understand how can they speak with some people with disability, maybe kind of dignity based. So we tried to publish a dignity based booklet for person with disability in 2020 and we published it and we sent it in lots of provinces of Afghanistan to make them happen. At least some people can read it, and then in lots of formal places or different area they can see, and they should understand how can they speak and how can they have good treatment with people with disability. So Afghanistan Human Rights Commission had secretariat of advocacy committee for people with disability, which was included over 15 non-governmental organization OBDs. And then the Afghanistan government official ministry, who had another group of kind of person with disability stakeholder coordination group. So we tried to work together to solve the lots of problems that we have in case of persons with disability. I'm trying to speak about a little bit about the NGOs and INGOs who had a very, very important and vital role in this period. Most of the INGOs, they were very active for persons with disability, and they did a lot, like Swedish committee, like Serve for Afghanistan, Handicap International, who is still active there. So some of them work for inclusive education, some of them work for rehabilitation and inclusive education. Some local NGOs like also it was for landmine, and then for Rahyab organization, we work together to improve the situation of persons with disability. So landmine organization who worked, because if Afghanistan is like a very big kind of full of crisis country, and we have lots of people who suffered from the mines and from bombing and clusters like that. So we needed like this organization to help that people with disability in case of their peer support, their education, their artificial, and lots of the problems and issues that we have there. And this organization tried to make 200 public places accessible for persons with disability, like parks, mosques, like some ministries and this and that. And the CCD was another organization. It was a community, social community for persons with disability who worked mostly and advocate mostly for the political rights of persons with disability, like electoral rights. And the Rahyab organization, which had three main goals, like prevention from the next generation with disability. We tried to consult with the families to have like genetic tests before marriage, or we tried to encourage them to don't go to the most, very close relative marriage, because it was kind of custom in Afghanistan that they went with this kind of marriage. And then we had rehabilitation and inclusive education for persons with vision impairment, and we had advocacy for all persons with disability. Still, we are working there, although very limited and with lots of restriction and problems, but we are trying to have our work. And for the first time in 2010, we introduced the White Cane Day for persons with vision impairment there in Afghanistan. Till that time, there was nothing about persons with visual impairment in case of kind of celebration like this. So in Afghanistan, we tried a lot, all of us, in commission, in non-governmental or NGOs, INGOs, to use from some days like person with disability day or the week for person with hearing impairment, or 15 October for person with vision impairment day, because we wanted to advocate and we wanted to tell to our government, this is the situation and you should do this, you should do that. And this was kind of an excuse for us to have attention of media, have attention of international society, and have attention of national government in case of persons with disability. And in the last maybe some years, we had this occasion very high position. Lots of people try to have this celebration, and they try to have like this attention. So nowadays, as you know, the de facto government is under power in Afghanistan, and the person with disability situation is very bad. And there is most of the local organization, which as an example, I told you some of their achievements, they are not active. INGOs activities is very limited because of the sanction and because of lots of problems that we have. And you all know I don't want to go to the details. And so if we think about just yesterday's earthquake, who knows how many persons with disability was there? How many persons got disability yesterday just? How many injured persons are with disability? Who can help them? What is the response or like a emergency response for this crisis? So what should be done? I think again, inclusion of persons with disability in lots of decision-making area and the leadership area, because we can't make any improvement in person with disabilities life without including them there. And the other big issue for person with disability, again, they left behind very badly. It was about their human rights activists and journalists and lots of people with disability, which we tried a lot to be active there, person with disability. And after this crisis, sorry if I'm telling like that, international society even left them behind, and they didn't pay attention about them. Even most of delegation went to Afghanistan, and none of them see person with disability. Just after lots of advocacy with Mr. Richard Bennett, who is special rapporteur for human rights for Afghanistan, he went and see some persons with disability. So my recommend is to pay attention about people with disability in Afghanistan, and don't forget us. Thank you.
Thank you very much. Thank you very much, Vanessa. So she is a kind of model in our country, Afghanistan, as a woman and activist. So we have some times for the questions. So my friend Christy Zimber will help me to read some question from online and help for that. And first of all, we will get 2 questions first from the floor, and let me take advantage first. So my questions, when we will ask the questions, please kindly address to whom you like to answer, and welcome everyone again. So we will start the second session of the first part, and now we will present the third panelist. He is Mr. Bukai Abanyan. He is from Liberia, and he is a board member of 77 Disability Center, and he is self-advocate, and he's working on as a consultant in several disability inclusion and social inclusion expert at many organizations, local and international organizations. And he's also support as a research assistant and several research and disability CRPD shadow report. And also he is not only in Liberia, he is actively involved in the Africa and also globally. So please welcome Mr. Abanyan for his session.
All right, good morning, everyone, and thank you for the splendid introduction. My name is Boakai Enyen Junior. I'm from Liberia, and I'm happy to be here. I will be presenting on the P14 after crisis at the Detecting International Disability Law Summer School Conference. I will be speaking on some few topics, and we have to do with a brief histories of Liberia, statistics on people with disabilities in Liberia, disability in Ebola in Liberia, the economic impact of the Ebola in Liberia, and impact of the COVID-19, coupled with the recommendations and conclusions. As you may know, Liberia is a very small country located on the west coast of Africa. It covered an areas of about 111,369 square kilometers and has approximately 5 million people, just a small little country. And Liberia is bordered by 3 countries. We have Sierra Leone and Guinea, Africa Coast, and the north by the Atlantic Ocean. Liberia gained her independence in 1847, and English is our official language. The Conventions on the Rights of People with Disabilities was signed in 2007 and ratified in July 2012. Just a brief statistics on disabilities in Liberia. There is a scanted and inaccurate data on people with disabilities in Liberia. According to a study performed by UNICEF in 1997, people with disabilities represent about 16% of the populations in Liberia. This prevalence is probably closer to, let me just say 20% due to the civil crisis, because people are gradually getting disabled either through accidents, stroke, and other sicknesses. So we assume that these sensors or data on people with disability, it is lesser than the reality. Disability and Ebola. There is a little research and data on impact of the 2014 Ebola virus on people with disabilities in Liberia. We have realized that during natural disasters and epidemic, people with disabilities face series of physical and emotional barriers and challenges. This is due to the lack of adequate and trained doctors and health workers, and as well as infrastructures remain a barrier for healthy living conditions for people with disabilities in Liberia. In many cases, patients with disabilities, including those who have hearing and speech impairment, are always victims of these challenges and or do not receive medical treatment. It is a proven fact that people with disability are among the poorest. Access to affordable and accessible education, especially in Liberia, remains a challenge for people with disabilities. The economic impact of Ebola. Due to less opportunity to acquire proper education, job for people with disability in Liberia, people with disability independently support, people with disability cannot independently support their family during such a crisis. As we all may know, people with disability are among the poorest, again, as I said, and living in poor infrastructural facilities with low income. The point I wish a disabled person face social marginalizations and lack of access to education, employment, health care, and legal representation, they may be more marginalized. Government support to people with disability during Ebola virus was limited. The lockdown created additional suffering and starvations for disabled people and their household in Liberia. During lockdown, people with disabilities, we were like, it was such a challenging situation for the fact that there is no much job opportunity for people with disability in Liberia. And during the lockdown, people were asked to remain home, and you couldn't just access what you want to access from outside, especially reaching out to family members and friends, and to access one or two a meal or send for yourself to support your family. The COVID-19 pandemic in Liberia. In March of 2019, Liberia received her first confirmed case of the COVID-19 pandemic. And the COVID-19 entered Liberia through one top government official named Wiferd. And that created a space of fear and mourning for people with disability, especially for the fact that we have experienced the impact of the Ebola in Liberia, where people with disability were not catered to, and there were a lot of suffering, there were a lot of starvations, and it was just like, wow, this seems to be a situation that will wipe away every person with disabilities, because we don't just have means of accessing job and bank accounts and other support. So when government pronounced that there should be a lockdown, that was a total state of chaos among the disabled community. For the sake of these presentations, I would have loved to present for at least maybe 2 hours, but for the purpose of these presentations, I'm just going to reduce my talking. So strictly, we drop down to recommendation. Our national government needs to prioritize and ensure more equitable responses to health systems for people with disability, especially during emergencies, infectious diseases. And UN High Commissions on Human Rights should impose some kinds of punishment, because at times this just grabbed my mind. A law that will not be backed by some sort of punishment it appears to me like it is vague, because now we look all around the world. I'm just glancing through all of the presentations that have been made and concerning the impacts and right violations of people with disabilities. And we have the conventions on the rights of people with disabilities that speak to these issues. And countries around the world have ratified and signed these conventions, but yet they are not implementing what they affix their signature to. And many of these countries attend conferences, go to the UN conventions, and express some fabulous report expressing that their country is on top, their country is doing well, and people with disability are all perfect. So if the UN human rights could impose some sort of punishment or penalty on countries that will not adhere or implement properly the conventions on the rights of people with disability, I believe that this will minimize the downplays of the implementation of the conventions. And there should be a global call to opportunity that will ensure the developments of people with disability at all levels. Many a time, and I will restrict this my presentations or these portions of the presentations to Africa. Many a time, people centralize the issues of people with disabilities. For example, there's a call for occasions. I am to attend this occasion from my country, and I will do a lot of communication. For example, this occasion is self-sponsored. I don't have money, and this is something that will benefit Liberia and people with disabilities. I don't have money, and to attend these occasions, I will have to write communications to various institutions explaining the intents of the occasions, the benefit, and what will it bring to the country. And you will notice that people will not provide the necessary support. And when you get back, they're going to ask you for a report. Well, you got to give a report and have the occasions, and they would like to take the glory. So there should be a global call to opportunity that will ensure the development of people with disabilities at all levels. I'm sorry, I have 16 more slides to present, but I think I will just conclude with this one. I'm proud to extend my gratitude to the Disability Law Summons School for these unique occasions, and I'm happy to be here. I'm happy to meet the many faces that I have seen, the friends that I've made, and it is my hope that we will continue on the networking, the connections after this conference. Thank you.
Thank you very much, Mr. Apunyin, for the good, wonderful presentation about the health and post-COVID.